think we're on.
There we go. So it is picking up. Hello.
Hi there.
Welcome to Rethink MS. I hope everyone can hear us. This is all really new, so if you can't hear us or see us, please let us know. We are joining you today just so we can introduce ourselves a little bit, let you know what the project is going to be about, and let you know a little bit about us and our stories. And hopefully we can get to know you guys too. So I'm just going to wait and just give people a little bit of a chance and see how this is working and make sure everything's working okay before we get too far in. So we'll just...
Hey, we've got one person watching. It's going to be very annoying.
So just give us 60 seconds.
It's all the technical.
Give me 2 seconds.
Excellent. All right. Fabulous. Do you want to start with an introduction?
Yeah, we can start. So Rethink MS came around. I met Emma on a what would you call it?
Committee.
A committee together, representing people living with multiple sclerosis. For me, I was diagnosed quite young, so I wanted to really raise some awareness among people who may not have been exposed to multiple sclerosis, but also give people who are living with the disease a place to come for support and a place to come and share and just let out if they need to. But we also understand that there's a lot of people who may watch this who have little to no understanding about MS as well, and I guess how it actually does affect our brains and where it comes from. So we want to cover that first before we go too much further. Mm-hmm. So MS, multiple sclerosis actually is multiple scars. That's where that comes from, because we do have multiple scars in our brains for some, and brain and spine for others. And those scars come from damage. So our immune systems in our body are meant to protect us. That's what they're normally meant to do. That's the belief that we have. But for us, our immune systems attack our brain and our spines. In our brains, we've got a really handy little whiteboard. We're going to have a whole new setup from next fortnight. We're streaming from uni today, so we managed to find a little bit of space to do this just so we can introduce ourselves to you. But for those who don't understand, in the brain, there's so many nerves. Millions, and it's just made up of... We're just made up of tiny, tiny little microscopic nerves. One nerve. Each nerve is surrounded by this little coating, which I'll show you in just a second. I am not an artist, so don't judge me. But this is how I was taught. Our nerves are coated by these coating called Myelin Sheath, and that coating around the nerves protects the nerves. The purpose and the main job of the nerves in our brain, to start with, is to send messages to our body. Everything that we do, moving my fingers, talking to you, looking, seeing, feeling, smelling, everything that we do is messages that have come from our brain, from those nerves. Mm-hmm. So when our immune system decides to get hungry, it comes up to the nerves and it chooses one, and it will eat away at some of that myelin sheath. And when that happens, in those spaces where it's lost that coating, that protective coating, we get a disruption. So where it's missing, you'll get a nice message from the brain saying, I want to move my finger. So it's saying, move your finger. Some of that coating's gone, the message is disrupted. Tries to go, message is disrupted. So the message is either slowed down or it's completely confused and comes out in weird ways, twitches,
words,
everything from tripping to slurring our speech to anything. And it's so different for everybody because there are so many nerves. So depending on where your immune system chooses to feed, depends on where the damage is done and how it affects each person in their body.
And there's lots of different types of nerves. So you have nerves that feel heat and pain and pressure and touch, and you have nerves that move, and you have nerves that are reflexive as well. So if you can imagine walking down your corridor and into your lounge room and you kick your toe on the couch, and there's always that moment, that tiny little gap between when you kick your toe and you know it's going to hurt. And that's literally how long it takes to travel the 1 point whatever meters from your toe to your brain. So for me, I might have something that's affecting the sensation on that nerve. So it might take a little bit longer, or it might not feel like anything, or it might feel like I have had my whole foot cut off, or it might feel like a burning sensation rather than a pain sensation. So the nerve gets confused and all jumbled up.
Yeah. So, I mean, as you can see, and one of the biggest issues with MS is that because it affects people so differently and so many messages need to be passed around in the brain, it's really hard to diagnose, because people fall over all the time. Doesn't necessarily go, that person has MS because they've fallen over. So quite often MS is late to be diagnosed or misdiagnosed, and it's really, really difficult process. MS, the other confusing part about MS is there's not just one type either. So we will probably go into that a little bit deeper. There's relapsing remitting. There's primary progressive, secondary progressive,
Benign, and what's called CIS, which is a clinically isolated something the S stands for.
So we both still have lots of learning to do as well. So we're actually learning with you.
Yes.
We're both quite newly diagnosed as well. So we thought, before we go too far into all of the science behind it and just bore you and scare you, we might talk a little bit about us and our stories so that you can get to know how the disease can affect people. Would you like to kick
sure.
off?
So my name's Emma, and I was diagnosed in 2017. So in June 2017, and about 6 weeks beforehand, I started having a lot of problems with my hands, and I said to my husband, my hands are bothering me, which was the understatement of the year, because I was dropping coffee down my shirt at work. I was misplacing things, so I would go to put something on a table and completely misjudge where I needed to put it. I was having a lot of pain, and it felt like I'd slept on my arm wrong or leant on my ulnar nerve as well. So that kind of, when you hit your funny bone, that kind of sensation. So I went and saw my GP after a couple of weeks of this really bothering me, and they said, well, could be diabetes, could be severe B12 deficiency, it could be AIDS, or it could be MS. And I remember thinking, goodness, I hope it's diabetes because I can manage diabetes. Rather famously, last word there. So he sent me off for a heap of blood tests. I was fit as you could be, really. I was training for a half marathon. I was working my dream job. I was very fit and active. Didn't really have any reason to suspect it was something like MS. It was never on my radar. Was told that I could wait 6 weeks, it would probably get better on its own. I was fit and healthy. There was nothing in the blood test that I did that indicated it was, B12 deficiency or anything. It wasn't diabetes and it wasn't AIDS. Just to clarify, I was a clinical midwife at the time, so the chances weren't zero that I had been possibly exposed to HIV, because I work with people of lots of different presentations, but sometimes they do have HIV and Hep B for that matter, but you can vaccinate against hepatitis B, not AIDS. So it was an occupational question for me at the time. I opted to pay a very large amount of money to have an MRI, and I remember the look on the radiographer's face after the MRI, because they're sitting in the little control room next to the big machine and obviously are seeing the images as they come up. And mine had pretty clear evidence of very big white spots on my brain pictures, and that's pretty horrifying for anyone to see. I think you can Google pictures of brain MRIs to see what MS looks like, and mine was pretty classic and it was pretty easy to see. And they looked very professional and they couldn't say anything, but I knew what I kind of had a good idea. So that was on a Thursday, and unfortunately I became quite unwell. So by the Sunday I was in hospital because I was in so much pain and needed steroids. So I was diagnosed pretty quickly. In hindsight, I probably had problems on and off for a long time. It's one of those diseases a lot of people will say, oh yeah, I had that thing 5 years ago where I had a weird numb spot or I was tripping over a lot of things, and in hindsight I probably did, but
I always wonder that.
Yeah, and for me, I unfortunately have well, not unfortunately, was then able to have a spinal MRI as well, which is something that you need to be referred to from a hospital. You can't get referred from your GP for that one. You need a neurologist, and you have to either do it through the public system or you have to pay like $1,200 for a spinal MRI in a private system. So I was lucky to be in hospital and had one of those, and unfortunately the reason my hands were bothering me so much is I happen to have a scar on my cervical spine, so right up the top of my neck where the nerves that look after my hands live. I've got a big demyelination across there, so yeah, my hands were affected as a hallmark of where that scar was. So
being a midwife, that would have been really terrifying.
It was. It meant I had to think very carefully about what I was doing. I did end up having to resign from my job. I never went back to it because my hands were affected so much. And of course, being a midwife, I was working with babies and women and sharp implements and medications and lots of things that relied on my hands. So unfortunately for me, I did end up hanging up my career, and I've had to change careers. So we'll get into a lot of these like really meaty things, but it's not been an easy journey. I do laugh about it now, but I do remember sitting there with the neurologist with my hands that like I couldn't pull my pants up and I couldn't brush my teeth, and I was in a world of pain, and I was like, they'll grow back, right? And the neurologist had to explain that unfortunately in our bodies, once the myelin is damaged, our bodies, if I could just put this for a second, our bodies can come along and make kind of an effort, and it might fill in with a plaque, but it's never going to build more myelin, and that's where a lot of the research is. But unfortunately at the moment with this disease, once the damage is done, we're stuck with it. So it's a concept you need to get your head around when you're diagnosed, that you're stuck with it. It's not something you can recover from, you just have to live with. And that can be really hard if you've had it affect your legs, or in my case my hands, or your balance, or your sight or something, and you have to adjust to it being permanently gone. There's no cure for it. So yeah, but that was a few years ago, and I'm fairly healthy still, so we'll talk a lot more about that. But what about you? How did you come to be diagnosed?
It was so terrifying. I was really young, so I was 27, and I had just given birth to my daughter. So we had quite a traumatic journey having her. I did have her through IVF, and then I had a really traumatic birth with her too, which quite often I believe it can be a traumatic event or some significant illness that can trigger a flare or a relapse as such, so that you experience all these symptoms and say, I need help, something's wrong. So for me, I believe it was birth and the postpartum period. I was a new mum to a new baby, and I expected to be tired. Like I knew that I was supposed to be tired, but the tiredness and the fatigue that I experienced after having her was like nothing I've ever experienced before. The only way that I can describe it to people is like walking, if you were to imagine walking around but with weights strapped to your arms and your legs all day, every day, and walking around like that and feeling like you're dragging weights behind you. And I would be sitting on the couch and falling asleep, and my eyes would sting and burn with how tired I was. And the truth is, I was really lucky, and my daughter was really a good sleeper. She woke, she was a baby, but compared to, some friends of mine who had babies the same age, she was a really good sleeper. So I started to question, why am I so tired, and why are my eyes stinging? But that's not when I started asking for help. I kind of just put up with that being a new mum and not really knowing. And then I had a shower one day, and I would struggle getting hot, and my legs just gave way in the shower, and I had a fall. That was because I got hot, and a lot of people with MS are intolerant. I think you'll find that nearly most people, or nearly everyone that I've spoken to with MS, struggle in the heat. So for me, I must have gotten so hot my legs gave way. Quite unusual for me. I had dizziness, balance issues. I felt nauseous all the time. I had numbness in my pinky finger and down this part of my hand. And I went and saw a GP who said, oh, you're just holding a heavy baby, so they're just pressing on a nerve, and so you're losing some feeling in the finger. And I went, I've tried holding her on the other side now for a while, and that feeling's not coming back. And they just brushed it off. So I went to a GP who I had seen really on and off for all my life. My family have seen those. That's the same GP. I believe that same GP told my mum that she was pregnant with me. So she had been in the family for a long time. Saw her at my 6-week checkup and said, I'm just not feeling right. I've had a fall. I'm struggling when I'm having a shower. I'm in pain. I have numbness. And she's like, you're just a new mum. You're just tired. You're just worn down. And I'm like, don't believe you. Trust me, I know when something's wrong. So I persisted, and I saw 5 GPs. And in the end, it was the last time I saw her, the GP said, I think you might have a benign tumour on the pituitary.
Goodness.
And I went, all right. And she said it really casually, like, it's okay. She said, but we'll just wait on it for 3 months and then see how you go. I was like, I had my mum with me in the waiting room. I said, they told me that they think I might have a tumour on my pituitary, but GPs can't order MRIs apparently, so I'm just supposed to wait it out. Didn't feel right to me. So months later, I went and saw a new GP who had never seen me before. I'd never been to them before. And first visit, she said, we need to order you an MRI. And I was like, thank God someone's listening to me. So had the MRI, I think it was only like the next day I had an appointment. That day I was laying in that machine and I was waiting for tumour. And I was thinking, at least if it's a tumour, they can treat it, remove it, go from there. If it's benign, fine. Sitting there, and you can see there's like a mirror in the MRI machine, so I could see through the mirror as I was laying in this cage. So you're laying in a tunnel with a cage over your head, so you can't move. And I think I was in there for about 2 hours. And they put me in and out, and there was just a team of people I could see through the mirror. And I'm going, they found something. They've definitely found something, but of course they don't tell you anything. And that same afternoon, I got a call from the GP, and I pulled over on the side of the expressway, and I had my daughter and my baby in the back asleep. And they said, have you ever heard of multiple sclerosis? And I went, well, yeah. And all I, heard of with MS was, you're in a wheelchair, basically. And I thought, worst case scenario. And he said, it looks like you've got MS. I can confidently say that you've got lesions all through your brain that indicate that you've got multiple sclerosis. I, to this day, will never forget, I get quite emotional about it, how I felt. And I said I wouldn't cry on the first one. So I sat there and I called my partner, and I was an absolute mess because I was so terrified. And I had my beautiful little baby in the back who we had tried so hard for so many years to have, and I thought my life was over. So I got in the car and I drove to my mum's house. I didn't even let her know. I couldn't call her to warn her what had happened because I knew that she would freak out too. And I got there and we talked it out. I needed to see a neurologist, so I got a referral seen within 2 weeks, which was pretty lucky in the public system. Got a really good GP who backed me up there and called the hospital directly. Had another brain and spine MRI. I think had 21 vials of blood taken.
So when you're diagnosed, did they tell you what kind of tests they did?
Oh, they would, but at the time I wasn't processing.
So they check for everything under the sun, things you've never heard of. They check for something that's referred to as JCV, which is John Cunningham virus, which is this virus that comes and goes. It doesn't even make you sick. Your body doesn't even really, it doesn't do anything with it unless you're on one particular drug for MS, and then it goes rampant and eats your brain and kills you within 12 months. So they'll check before they give you this particular drug, but they also take blood in this really weird like light purple cubette. It's a really oddly shaped, but yeah, they take like 22 vials of blood. Like you feel like, oh my goodness, I didn't even know you could take that many. And they are checking for everything, like things you've never heard of, just on the off chance you've got something as well as MS, but also to check your immunity to a whole heap of things, because once you start treatment, because it's an autoimmune disease, they then need to knock out the bit of your immune system that's playing up. But it also means we can't have live vaccines now. So if you had another baby, you wouldn't be able to have the MMR because it's a live attenuated vaccine. You wouldn't be able to have polio, which is sometimes a live attenuated vaccine as well. So, and chickenpox is the other one you need to check your titers before they do that.
But yeah, it's terrifying. But I mean, again, you and I both have such different stories, and obviously with the damage being so different for the two of us, our symptoms are really different too. And that's a really big thing for people, is everybody's symptom is so different. I think that the main symptoms, the most common symptoms that people get is fatigue, so chronic fatigue, heat intolerance and cold intolerance. I get both. Pain, chronic pain. I get nausea, dizziness. I believe they're pretty common too.
I don't, thankfully, knock on wood.
Yeah.
Yeah, but we did joke. I think we bonded a little bit because I mentioned that one of the weird ones for me was like, is my phone ringing in my pocket feeling? And it would be like, yeah, my phone's ringing even though my phone is sitting somewhere else. And you're like, is that an MS thing? And apparently it's quite common for people just to feel, or I also get like a random drip of water down one of my legs as well. And I know it's not my water bottle leaking, but that's what it feels like. It's just strange this little drop. And it's just this strange sensation. Other people feel they've got like grass brushing their leg, or they will feel a vibration in one like yay-sized spot on their arm or on their back. And that can be really annoying. I think MS symptoms sort of fall into two categories of life-altering, like fatigue or heat intolerance, and also just plain weird and annoying, like the mobile phone vibrating in your leg pocket, even though it's not there. Yeah.
So yeah, symptoms are so different for everybody, and I think that's one of the biggest things. And there's one of the hardest things I can say for me, and I think for a lot of people too, is that people don't understand what it's like to live with MS unless you live with it yourself. Even doctors and neurologists who know just about everything that they can about MS don't really, if you don't have lived experience, you don't really know. So it's really hard to explain how you feel, to have people understand and sympathise if they haven't felt it. So it's a really, really big thing. And that's why this is really important, because we're hoping that we will be able to, as the weeks go on, focus on particular topics, heat or mobility or pain, medications, all the different things that people do and experience, so that you can understand what it's like. And being young, you know, I'm walking around uni most of the time, people wouldn't look at me and think that I have multiple sclerosis. They just wouldn't, because it's invisible. So if I need to take the lift one day, I avoid it with everything, because I think people can look at me and go, how lazy, you know, just take stairs. I know. But for me, I wish people had more of an understanding about disability, medical conditions, chronic illnesses of all ages and of all appearances, because it's not just about needing a walking stick or needing a wheelchair. And although it is, there are people with MS who have lost a lot of their mobility, and it's really important that we do acknowledge that too, which we will. But for our experiences to explain of how it's affected us, for me, I'm very lucky. I don't have spinal lesions, so I don't have mobility issues as such. I have mostly invisible pain, fatigue, nausea, dizziness. I had this one experience. I was trying to walk down my hallway, and I was walking, and my body started walking to the left, but I was trying to walk straight, and my whole body just tipped all the way to the left, and I could not stand up and I could not walk straight. It was really scary. And I just leant against the wall for a while, and I called out to my partner and had to go sit down, and I span out for a while and came good. But my body just got really confused, and messages weren't communicating, and I was saying walk this way, my body was saying walk that way. So
interesting.
Yeah.
I found it quite interesting. There's no one picture for MS. It can be diagnosed. It's not congenital, so you can't be born with it, but babies as young as like 2, there's recorded. There's someone else who, when I go in for an infusion, the medication I am on is every 6 months, and there's another person who's there, and they were 11 when they were diagnosed.
So young.
And they're just finishing high school now. And it raises different questions when I have children. I'm not planning on having any more. So that wasn't a conversation, but that's a topic we're going to touch on, about what that looks like for women who are wanting to have children in their future or in the middle of making their family, and also for partners who aren't going to be carrying the baby, either they aren't the birthing partner, but having a new baby is exhausting. It doesn't matter which parent you are.
Yeah,
it's a special kind of tired. But it affects anyone, and it doesn't magically stop being diagnosed when you're 45 or 50 or you hit menopause, or there's no rules about it. You can be diagnosed 70, 80. You can be diagnosed when you're very young as well. So, and it's a really different lived experience and really different journey. And I think MS is one of those things. It's that it's a disease, it's a chronic illness, but it's also potentially disabling. So certainly my attitude now is to get in, live my life, take the opportunity to live big, because to a point I don't have any control over it. But in the beginning, certainly it's really scary. And what Jess and I want to do with this project is to say, absolutely, I remember how scared I was. I remember crying for like 6 weeks non-stop, and just I was convinced that my husband should leave me and find another partner who was healthy. And I think a lot of people go through that sort of...
My partner tells me off for doing that. I don't know. I think I still do it. I go, you have an out if you want one. She gets so angry with me.
I know.
Stop saying that.
He's like, why? Why would I do that? And I'm like, because I've got this. And he's like, yeah, I'm still not hearing a why would I leave sort of thing. And I think a lot of people do go through that. And I think we also, I found it really backwards, because if I go to my doctor and I say, I've got a rash, and it's annoying me, I've tried some calamine, it's still annoying me, they'll go, oh yeah, it looks like it's whatever, poison ivy. It's not in Australia, but it's poison ivy, so here's the medication. Or you go to the pharmacist and they say, yeah, it looks like you've been bitten by something, we'll draw a circle around it, here's some, like that kind of thing. With MS, the weirdest thing I found is that the first thing you get given is these brochures on drugs, and they're like, so you can choose, here's your 4 options, and there's about, I think there's 14 or 15 medications that are on the PBS, so you can access them, and they're everything from a tablet through to an infusion. There's some trials going on with really high intensity chemotherapy and full immune system resets as well, or you can travel overseas for those. And there's injections, and there's like every 3 days and every week, and there's lots of combinations. But like,
How good that we have those options now, though.
So good, but you get to choose, and it's such a strange thing because, and what they're saying is, are you okay with doing an injection every day? Because a lot of people can't do that. Or will you remember to take a tablet? Would you rather a monthly infusion? Are you wanting, like, what do you want to do with your life, sort of thing as well? But that's really, I found that really hard because I had so many questions and I wanted someone else to say, this is what I think is the best one for you.
It's very overwhelming.
Yeah, and even since I was diagnosed, we've had Ocrevus come onto the PBS. So you used to be able to do that privately at something like $16,000 an infusion. And Mavenclad also came on, and then 2 more have come on even since then. One has finally come onto the pharmaceutical benefit scheme for one of the progressive. I think it's primary progressive as well. There's not a lot of medical treatments for that. So just like the choices are so overwhelming. We are so lucky to have a public system. Neurologists who are like top of their game. And
in Australia, of course, it's different.
Yeah, so in Australia, I might pay a gap fee for a medication and for parking. And that's what I pay. So the public system will look after you if you have MS, and that is not the case. And we are aware, and we're really hoping that people around the world will tell us about their journeys and about the choices that having different styles of healthcare. I am never ever going to ignore the fact that we are so privileged here to have universal healthcare, particularly when I'm looking at having, let's say, another 40 years of being looked after by the public. By the public health system is just invaluable.
Because I'm on a drug, because I too got offered all of these drugs at my first appointment, and me and my partner were like, okay, like, and they all had these terrible, terrifying side effects. And one of the biggest ones, which we touched on before, was this JC virus, which they test you for when you're first diagnosed. You're either positive or you're negative, and it's really, really common to be positive. It's being exposed to, it's like, what is it? Like, that's kind of like the chickenpoxy one, isn't it?
Yeah, it's like the zoster viruses, or it's like strep A, which causes tonsillitis, and strep B, which lives in the gut, and it comes and goes, transient as well. So yeah, but they discovered, unfortunately, for quite a few of the drugs, that if it crosses the blood-brain barrier, it then makes plaques, and it eats your brain within a year. It's absolutely horrifying when you're told that as well, and I'm like, oh good God. Surely the benefit has to be huge if that's the risk I'm taking. And yes, the benefits are huge, but it is also a risk. But also we're not doing anything.
Yeah. So I think
it's a risk.
If you're positive, you have a lot of neurologists will say stick to these drugs, less risky. If you're negative, you can have choice of all of the drugs. I was negative when I was first diagnosed, and I chose a drug called Gilenya, which is a once-a-day tablet. I thought that's simple. The side effects, the big side effects for that drug that were possible were or are skin cancer. I'm at really, really high risk for that. I think there's multiple cancers that I'm at risk for. Gilenya also causes pain, so chronic pain, which I'd love to have people that join us eventually from different countries, because when I chose my drug, I chose it because it was a once-a-day tablet. It was easy. My partner was like, don't give her something she's going to have to remember to take all the time, because she's really crap with taking medications. So my partner does basically monitor whether I'm taking, have you taken your tablet tonight? I'm like, yes, I've taken my tablet tonight. Oh no. So I'm really lucky in that. But so for some people, having an infusion to just go in and have it once every 6 months or once a month is a bit easier. But I chose the drug because the side effects were less scary. I since have come up as JCV positive. So if I need to come off of my drug, if it stops working, or if, I'm having massive side effects, then it limits as to what drugs I can go on now, because my risk of developing PML, which is, in short, it's a crazy brain infection that it's life-threatening, put you into complete coma, a full, vegetative state, and you're just unresponsive and very quickly. There's nothing you can do. So all of the MS drugs have that risk, unfortunately. So that's a massive, massive thing that we have to think about all the time. And even though they say it's rare, it still plays in your mind all the time. But yeah, for my drug, we get the brochure with all of the common side effects, and it had them all. And I went, yeah, I can deal with that. And then I started about 4 weeks later, I had this pain. And my arms felt super heavy. They were really, really painful. Just quickly, I want to acknowledge as people actually saying hello to us. Hello, Caroline. Hello, Danny. Lisa, who's my partner, who's super supportive. And Ashley, who's also super supportive, a friend of mine. So thanks for joining us. So I forget what. See, and the other thing with MS is you get really terrible memory. So I'm like Dory. So I'll be thinking, I'll be talking, and then I'll stop halfway and go, what was I talking about?
The whole walking down the other end of the house, and you're like, what did I come down here? Like, no memory. No idea what I came down, even though I've walked like into a room and I've opened the cupboard and I'm like, I don't remember. And it's not that I can go back and then go, oh yeah, that's right. Like seriously, it is not even there to remember.
It's gone. It's vanished.
So frustrating.
I did a really funny thing that I have to, and I'm going off track, but we'll probably do this. This is just going to be, we're not scripting this, so we're just chatting. I carried, when I had my daughter and she was still a baby, I carried my baby all the way across the house and, lay her on her change mat in her bedroom to change her nappy. But when I lay her on the change mat, I realised that it wasn't my baby, it was my cat. So I'd actually laid my cat on the change table and I just stood there and I just laughed at myself for ages, and I shared it with so many people and I was like, can you believe I just laid my cat on a change mat? That's how tired and that's how foggy my brain was.
Yeah.
That's MS, does crazy things. It's not all the time though. Quite intelligent. I think we're both pretty intelligent people.
And I think it's exhausting in itself because we're so used to being on the ball. Like we'll do A and then we'll do B and we'll fit so much into our day. And then you just like, this morning, made coffee, put the coffee back in the fridge. Doesn't live in the fridge. Got a spoon, couldn't remember what I was doing. And I was just like, this is why. And we do joke, first the coffee, then I do something. And it's definitely the brain fog. I think if people who weren't diagnosed with this felt just for an hour the level of brain fog and fatigue, a lot of them would be, I need a coffee. And that's kind of the feeling, but 100,000 times.
And coffee doesn't actually do anything anymore.
No, and I think it always surprises people when I can have a coffee and then I can go and have a nap. It's like I can nap for Australia at the moment. I'm actually not doing too badly, not needing a nap every day, but it's I think quite challenging because I was a clinical midwife. I was working on call. I was doing what I'd gone to university to study for. I'd worked really hard to get there. And I was pretty used to being tired, of going all night, of being on call, of doing what I loved. And I was training for a half marathon. So I was quite used to pushing my body, knowing that I would recover. And that not ever recovering feeling was really hard. It was weeks before I felt like I could do anything. And the fatigue tends to fluctuate. So Jess and I both have what's called relapsing remitting. So a relapse of our disease would mean that there's new activity. So you would get a new area of damage. You would get a new symptom. So if I say to my GP or my neurologist that my legs are really bad, I'm tripping over, I'm having to drag one of my legs and I keep catching my foot, so that's called foot drop, they would be very concerned because for me that's new symptoms. If I say, my hands are really bad and I'm in a lot of pain and I'm dropping things and so forth, they'd be like, that's just what's called a pseudo flare, and that can happen if you get sick. So I had an ear infection. I didn't know about it, but I had an ear infection and I've not felt fabulous and my hands have been really bothering me. I had some antibiotics, ear infection got better, my hands are better, magic. So that's a pseudo flare. It's not new activity, but you still feel pretty awful.
So when you have relapsing remitting, what happens is you feel you're pretty stable. You have there's no active lesions. There's your immune system's not eating your brain at the moment. So you're feeling pretty all right. Symptoms still there. So you feel pretty okay, and then you have a relapse. And your immune system gets hungry and it starts eating away at that myelin that we were talking about before. And all of these, you might get new symptoms. So if you suddenly, like for me, if I suddenly noticed that I couldn't walk, I would know for sure that it was new because it's never something that I'd experienced before. So you'd have this relapse. You'd have to be treated. Usually it's steroids, IV steroids or oral steroids, and I haven't been there yet, thankfully, but I've heard it's pretty nasty. And then you sort of come good with that treatment and you come back down. And then you have a good patch again. But that damage that was done from that relapse never goes away. So it's really important to know that while we come good and we're having a good patch, that damage is still there. So those symptoms aren't gone. It's always going to be there. So people think, oh, you're in remission. You're stable. You're fine. What are you complaining about? But it hasn't gone anywhere. That pain is still there. It still happens. I have chronic headaches. I have headaches 24/7. I actually don't really know what it's like to live without a headache. I think that's been going on since I was probably a teenager, and I've always gone in and out of doctors and optometrists saying I've got headaches all the time. And I do believe, and it is likely, and it has been confirmed by the neurologist, that it is a thing, and it is probably MS that causes that. But those things never go away. I still have a numb finger. I'm used to it, so I don't really notice it. It's just a part of my body now. I've just adapted to it as you do. And everything, even the nausea, I live on Ondansetron. If I'm sick, I take something for it because otherwise I just don't function, and you just adapt your life to it. But those symptoms never go away, so there's always a little bit of damage. That's relapsing remitting. So you're up, you're good, you're down. It's just a vicious cycle, really.
But if you can imagine like a bundle of straws, and when you have a relapse, you get given more straws, and then you still have to carry them around. So even if it's only a small relapse, and there's not really the size of the scarring, where they are to a point, it doesn't really predict how much it will affect you. And you can have like a tiny little thing and lose control of one leg, and you can have a huge spot in your brain and you don't even realize that you've got a problem, sort of thing. And you can have weird symptoms, and the neurologist will be like, not sure that's an MS thing, we'll just rule out everything else and then we'll say it's an MS thing. And it's not
so frustrating though. I get both sides to it. I've had both where I'm like, I go to my neurologist and she's always like, I don't think it's likely to be MS. So let's just pay thousands of dollars to all these other different kinds of specialists and wait 2 years to see other kinds of specialists that will tell you that it's not that. So go back to your neurologist in the end. And that's basically the cycle that you go on. But in saying that, while you don't want everything to be put down to MS, you also want it acknowledged when it is, because you want to know what it is, how to treat it, so that I know this is just a part of my life now. I'll manage it and move on. You just need acknowledgement.
And you touched on pain before, and quite a few neurologists will swear on a stack of textbooks or Bibles that MS doesn't cause pain. And I would politely encourage them to review that assessment. Because the pain we're talking about isn't like you've broken a toe, a foot, an ankle, your ribs. It's not that kind of pain, and it's not you've done a really hard job or you've gone really hard at the gym. It's not that kind of pain. For me, I get it in my hands, and it is like Wolverine style pain. That's what it feels like, is right deep on my bones. It's called neuropathic pain as well. It's not the kind of pain that you can take Panadol for. Unfortunately, there's not a lot that you can do. You can take some medications for it, may or may not work. It's kind of that try it and see, but the side effects of them are pretty, I don't know,
awful.
They're pretty awful. So even something like pregabalin, which is Lyrica, there's lots of people who won't touch it, and other people who will take quite hard medications. Things like codeine and paracetamol don't touch it. They don't even, and it's not an inflammation in the like burn or muscle pain.
It's not a localized pain.
It's not. It's so hard to explain. But if you can imagine how much pain Wolverine is in having, like, that's the kind of pain I have in my hands all the time. And it's, if I sit and focus on it, it's it's very distracting, and it takes up energy to handle, and it fluctuates. So when it's cold, it's really hard for me, and when it's hot, it's really hard for me. And it's the fluctuations in temperature and the fact that I can go from a cool office outside to get in my car and I'm in a world of pain, plus I'm moving through sludge and my brain's not working. It's not a great combination. So when we say it affects mobility, it's not just that it might affect the function of your legs. It does actually affect where you want to park your car. It affects whether or not you go out and do something if it's above whatever your magical temperature. It's about 31 degrees for me, and I'm like, no, I'm not going outside because it just makes me non-functional. So
I find it, I actually haven't had this conversation with you, and I'm really glad that you brought it up now, because it's probably good for other people to listen to. But you've explained your pain, which we haven't talked about, as a deep burning pain of your bones. Now, my pain, I'm still negotiating with all of my specialists to try and figure out where the pain comes from. I say it hasn't happened since I've had MS, since I've been diagnosed, or since I've started my medication. So mine I described as well as, it's like my bones are just aching and throbbing, and I can just about feel a pulse in every part of my bone, mostly in my arms and my legs and my lower back, but mostly my arms, my legs, and the tops of my feet. Now, I have brought that up since about a month after I was diagnosed, and my neurologist swears it's not MS. I've been to a rheumatologist who did a full body bone scan, tested me for fibromyalgia, did say to me that no signs of fibromyalgia being the cause of the pain, some mild arthritis that could flare up later, but nothing that would be causing the pain. Neurologist says not MS. So what is it? I've even gone as far as pelvic pain specialists, everything you could ask for, and the way that you've described your pain is the pain that I feel, but I've been told it's not MS.
It's only pain that I've had since I was diagnosed. It's not the kind of pain that I would have ignored going back. For me, I was quite ill with it, and I had quite a sudden onset. We do hear a lot of stories of people who are like, I've been going to doctors for 10 years, or in hindsight, this thing that happened when I had a baby when I was in my 20s, and now I'm in my 40s, and it's really a problem. So, but for me, yeah, it fluctuates quite wildly. Like some days it's all I can focus on, and other days I just push it aside and just get on. It never goes away. But I get it down the outside of my legs and down, like from my knees all the way down, but it's bone deep. And that's what I say, it is this bone deep, just, and it's not an ache, it's like the English language does not have, let me think of the word in English sort of thing, like I can't even describe the pain.
I know, I've tried.
And for some people they have it on one side of their head, and the neurologist will say, well, it could be trigeminal neuralgia, and they're like, no, it's my skull hurts. I'm like, well, that's not nerve pain, you don't have nerves in your bones. So I don't know what the answer to it is. I put it down to MS because it fluctuates.
Interestingly enough, I started, obviously I'm investigating, because all I've been done is handed narcotics, pain relief. I tried every drug you can possibly think of to manage the pain. Panadol doesn't help. Nurofen doesn't help. Voltaren, any anti-inflammatory doesn't help.
No.
I've had Panadine Forte, which I still have to take regularly because it doesn't help, but it probably more just helps me take the anxiety out of the pain. And it helps with my headaches. Endone I used to take. I haven't taken that for a long time, and something that I really wanted to do with this podcast, and we will go into this later, it probably needs its own, is I was thrown heaps of narcotics, and it can get you in a really vicious cycle of taking them, and as a form of relaxation as well, and it's something that I didn't want to get myself into, and I chose to look at alternative methods, and for me that was medicinal cannabis oil, now that it's legal and can be prescribed. So I went down that route, and since I've been using that oil, I have not needed strong narcotics like Endone. Every now and then I'll take Panadine for mostly for my headaches, but that oil honestly has changed my life.
So just to clarify, in Australia it only fairly recently became legal to jump through quite a few hoops. It's not an easy medication to access, but you can access both CBD and CBD with THC. So depending on what you're prescribed and so forth, it's expensive. I pay $250 for it. Should last 4 months, but it doesn't. I need to up the dose, so I'm not using it faster than it should last for 4 months. What about you? How much money do you pay for it?
Just to see the doctor was hundreds, because obviously you need a special kind of doctor who's willing to prescribe it. My GP was happy. She's open to it. She hasn't been educated on it, which is the problem. The government should be educating every GP. But anyway, we'll get into that another time. I went and paid hundreds to see a GP who then prescribed the oil for, it's about $350 a bottle, which is a blend of both CBD oil, which is the protective agent of it, and then THC, which most people, recognize THC as, when you think about marijuana, it's that hallucinogenic, it's the high, but in the oil you don't get that. I don't get that.
Tiny dose. It's
minimal. I mean, mine is 50-50 CBD THC, but I don't get a high. I can function just fine, and I only take it at night because it does relax me, so it helps me sleep. But it doesn't have the same effect as your recreational marijuana.
Yeah, it's not. So it's not that kind of dose or experience at all. But for me, I have been using it for about 6 months now, and I have to say because when I was first diagnosed, I was in hospital. I was in a world of pain, and they were giving me a lot of endone every 2 hours, and because I was in so much pain, and it did dull it, numb it a little bit, I could see how easily I could get used to that, and then hanging out for that 2 hour mark so I could feel that relief from it. It didn't make the pain go away, but just that sort of euphoric feeling. And I can totally understand. Thankfully I did say no, I won't have any when I got home, because I was still in quite a lot of pain. But yeah, a lot of people, it would be interesting to hear how that is managed around other people, because I know if you're paying for every single visit and interaction, do you not get care like we do? I see my neurologist twice a year, roughly. Hopefully less than that, but it's twice a year at the moment. Do you have regular appointments? Or?
Yeah, I was 6 monthly. I mean, I'll be coming up, I think I'm 2.5 years diagnosed. So for a while it was 6 monthly. I was stable for long enough. By stable, I mean I had no new progression in my brain. So they said every 12 months. But I had a recent early MRI because I had the most bizarre, it wasn't a relapse, thought it was.
Thank God for that.
I lost my hearing in my right ear a few weeks ago, and I went completely numb. So I couldn't feel my ear, the inside of my ear. It was like I was missing this part of my face, and it just grew slowly over a few days. And when I drank hot drinks, I couldn't feel heat on the right side of my throat. So my neurologist was sure. She's like, I think that you might have
strange symptoms.
A new lesion on some part of the base of my skull. She said it would be, which isn't good because that's such a delicate area as well. And I didn't want that to be a recurring thing, that when I get stressed or tired that triggers my symptoms, that I would suddenly lose my hearing in my right ear and go numb on my right side of my face.
No.
It's not what you want. So I was really glad that it wasn't a relapse. Still trying to figure out exactly what it is, but it's not a relapse, so I'm happy. Forgot where I was going again with that conversation, but I'm sure we'll get back there. We're talking about pain before.
So what things... I guess we will touch on a lot of things. There's a lot of foreshadowing going on here about just how much we want to talk to you guys about, because what we both found and what we've talked about is when you're diagnosed, the doctor that you see is very interested in what your brain scan shows. And they may or may not show you. You may or may not get a copy of it. You may or may not see a report. They might go, oh, yeah, you've definitely got MS and these are your options. And then you won't see them for another 6 months. Or in some states, you will see a registrar. So you'll see a trainee neurologist, very qualified, very knowledgeable, but you won't ever see them again. I'm lucky. I've been seeing, since moving back to South Australia, I've seen the same neurologist. But neurologists here in Australia tend to work with nurses, and they are a collection of nurses who've done a lot more education and training very specifically in MS. So they are actually MS nurses, much as you would have diabetic nurses or you would have wound care nurses. They've specialised, and they are a little group onto themselves as well. So they have conferences and research, and they have approaches, and they will manage the, not day to day, but the sort of more nursing things related to someone with MS. So they'll check in with you when you have an infusion, and they'll call you and say, I'm going to post a letter from the neurologist to say you need to go and get these blood tests done, or they'll bother you once a year to say, have you had a skin cancer check, have you had a pap smear check as well, because we are at higher risk of getting those cancers. Those kind of day-to-day interactions are done by nurses.
MS trained, specifically nurses.
And they are the bee's knees of the healthcare profession. If I've got a question, I can send a text, I can call them, I can email. Mine, not all of them are that accessible, but in the public system they do a lot of the sort of the face-to-face interface, the nursing and caring every day, because obviously neurologists have hundreds of patients, but they're the people that you would
contact,
send an email and say, hey, I've got these weird symptoms going on, and they'll go, yeah, it's unlikely to be MS because of these reasons, go and see your GP. Or they'll say, have you had a COVID test? Then because I lost my sense of taste just after the pandemic started. I actually lost my sense of taste.
Oh, how upsetting.
I was fine. I was a little bit, it was June-ish of last year. Lost my sense of taste. Had a tiny touch of a cold, beginning of the global pandemic for COVID.
You had COVID, right?
No.
That's what I thought, though.
Yeah, so I called the MS nurse, and he's like, well, you need to go and get a COVID test. I can't see you before you get negative for that. And I was like, oh, yeah, I haven't been anywhere. I've been at home for like 3 months by that stage. Anyway, no, I did not have COVID. But after clarifying everything, yeah, I ended up getting an earlier MRI because losing your sense of taste is particular nerves, and it was a new symptom, and it didn't go away, and that was really awful. It came back after about 6 weeks, but that was enough time for me to be quite stressed and to have an MRI. I personally don't mind having MRIs. It's not how I'd choose to spend 2 hours of my life, but for some people they need to be supported and sedated. It is very distressing for them, because when you have an MRI, they're doing your brain, so you need to wear a cage, and it sits here, and then the roof of the MRI is only here, and it's loud. It is very loud. And
YouTube the sounds of an MRI machine. That's how I explained it. My eldest wanted to know, so I said I YouTubed it, and I played the sound to him, and he was like, you laying that? I was like,
yeah. So yep. they give you earbuds, because it's like really loud, and the bed, I find the bed gets hot. There's so much energy, so it's a magnetic energy. It's not radiation. We're not being x-rayed, so we don't glow afterwards. But it's 45 minutes to an hour and 10, hour and 15 minutes, depending on what they're looking at. So if it's just the brain, otherwise you're in a long tube. So they'll move you through the tube because it's like a donut, and you're moving through.
But you can't move the entire time.
You can't move, and you're lying there, and you can't move, but you can't fall asleep either, because you twitch when you fall asleep. And unfortunately, it's very hard to stay awake and not move. But they will play music. They usually put music on in the room as well, and you can ask, can I listen to the radio, or can I listen to Coldplay or a Spotify playlist of Disney or something, which is what a friend of mine does, all the Disney tunes. And I'm like, how do you not like sing and boogie along to them? And she's like, I don't, because then they have to repeat because
she's moved. I had that issue when I had my MRI just a few weeks ago for my ear, and I was laying in, and they put the radio on, and it was just the radio, so they were talking, and they had this guest come on who was a hypnotist, a comedian hypnotist from the Fringe, and she's like, oh, have you just got about another 10 minutes left? And I was like, okay, cool. So I was counting on those last 10 minutes, and as she did that, this guy came on and started hypnotizing the people on the radio station, and it was so funny. And I don't normally laugh out loud at radio things, but it was so funny. I'm laying in that machine, I could feel myself starting to sort of like move my body. I'm like, just 10 minutes, could you just turn it off? But I couldn't speak to ask them to turn it off either, because I was like, I've only got 10 minutes, don't blow it, I'm going to be out soon. So that was really hard to keep still, so you can't have anything fun.
Yeah, and it's not comfortable. You're lying on a flat, unpadded bed as well, and you're in like your underpants and a gown. You can't have anything metal. That's actually the worst thing for me, is I have to take out all my piercings every time I have, and because my hands are affected. The reason I don't like MRIs is it usually takes me a week to put all my earrings back in. It's like the first world problems about why I don't like an MRI. But it's sometimes when it's not as common now, but when you're first diagnosed, did you have to have gadolinium?
That's
the contrast.
I do every time.
Yeah. So the reason I use gadolinium is because it will go where there's a lot of activity.
It's a dye.
It's a contrast agent, so it's radio opaque, but it crosses the blood-brain barrier and it sticks to the new active lesions. So I have to have it because I have quite enthusiastic lesions, which is to say that I'm on medication that keeps it constrained, but if I came off them, I would probably have progressive disease pretty quickly. So it's enthusiastic, it's held at bay with these medications, but they give the gadolinium to check what the activity is, and it also means when you're first diagnosed, the international consensus on MS says that you have to have lesions that are separated by time and distance. So you have to have 2 lesions, and one has to be old and one has to be new. So they give you the gadolinium to make one of them light up, basically, and then they can say, yep, that's your old one and that's your new one. So it's given for different reasons. For me, it's to check what the activity is, and my report will come back and say something like there's no new activity, or that activity has decreased a little. They also check your brain volume, because with MS, for some reason, they don't know. As far as I know, the research is a bit unclear, but our brains actually atrophy. So our brains will actually lose mass, and that's really terrifying. That's what happens with people with dementia and with Alzheimer's, is that they actually shrink, and it's the thought bits that shrink as well. So and there's nothing that can be done about that. So they do tell you how much volume your brain takes up as well. So it was very funny. After about a year after I was diagnosed, my sister needed an MRI, and I was Googling pictures, and I found MRI pictures of like brains that didn't have anything on them. They're just black. So if you look up an MRI, it's just this black, empty space, which is good because it shouldn't show up on an MRI. Mine, on the other hand, has, spots on it. So it's a little confronting when you see pictures of that. We've got lots of people saying hi.
Look at
so exciting.
My supportive family over there. My dad is always, he is like actually the king of dad jokes.
Oh, is he? Excellent.
Yeah.
Excellent.
So you have to just tell him to just hold back a little bit, because he's in my partner's phone as king of dad jokes.
King of dad jokes, excellent.
Who would have thought that I'd be on? No, he said he always knew that I'd be on the medium screen, but who would have thought it would be for this?
Yeah, terrible. Well, I have to say, look, we've been going an hour.
Yeah.
We have so many questions. So are you ready to wrap up? And so on our Facebook page, you can shoot us a message. We've also got our email address, which is Rethink MS, all one word, @outlook.com. You can find us on Instagram as well. We're going to be posting lots of things about, I've got MS, but I can still do this, using examples from so many people. We've had questions about, how do I tackle this and how do I do this? I think I've got MS, or I'm pretty sure I don't have MS, and lots of questions. So we are listening. We'd love to hear what people want to know more about. We will touch on things like CBD and THC and diet and all the types of drugs and how some of them work, what the research is suggesting. We've had questions about vaccination against COVID.
we will cover those.
We'll cover everything.
You're welcome to, I mean, we're still getting very used to using this. I only got this stuff yesterday. So when you have a conversation with us, ask your questions live. If you're here, we will try and answer them if we can. And maybe somebody else that's watching will have an answer as well, or be able to sort of share that experience with you. So please feel free to just talk to us as we go along, because as we said, this isn't scripted. That's one of the things we didn't want it to be. I've listened to a lot of podcasts, and I'm not saying that they're not useful, because they are. They have a lot of information. But for me, I wanted to just have a chat and be able to just express and listen without, I can read. I didn't want to be talked at. So I wanted something a little bit different. And I think that this can be that. So we hope that you can. And this is a crazy time as well. So we didn't plan on doing this at 5:30 on a weekday. We were supposed to do this on a Sunday afternoon so that it was more accessible for most people. I and my partner got hit with food poisoning. Still haven't eaten anything for like 4 days now. So someone just got locked in the room next door. I think we've all been locked in because we're at the uni and maybe we shouldn't be here anymore. We'll leave in a moment. We want you to ask questions. We want you to talk to us, watch our stories, keep an eye on Facebook and Instagram stories, because I will communicate a lot through there about day-to-day things that I experience, like maybe the 10,000 stairs I have to get at uni to get to my car and how that can impact. And people might not realise that this young girl is actually really struggling. Yeah. Don't judge young people that don't have mobility aids parking in a disabled park. I don't use one, but many people do. So please,
we will have a conversation about what it feels like not to be in a wheelchair and still need to use that little blue sign.
This is also disability.
Yeah, and the fact that on a good day, on a good day, good days are good. Bad days are different for everyone. What that looks like as well. Just to wrap up, Jess and I came together because we are on the People Living with MS committee with the MS Association of South Australia and the Northern Territory. They are not sponsoring us. We're not talking as their mouthpiece, but they have been so supportive and so enthusiastic about us. They are helping us with our equipment so that we can reach the most people that we can. And we are hoping to be using their offices on a Sunday afternoon. So today is the 1st of March, and we'll be doing this again on the 14th of March, and then every second Sunday from then. So we will be using their offices as well on the weekend. So a big shout out and thank you to the support from the MS Association of South Australia and the Northern Territory. In particular, Christine and Tim as well have been just amazing. They've just stepped up and said that is a great idea, because they certainly see us living with MS as the people who should be talking about
they're
MS
listening
as well.
And they're really trying to help people. So again, they're not sponsoring us, but I have nothing but good things to say about the MS Society.
Absolutely. And it's very genuine, not yes, you should go and have your little side pet project and we'll go and do the real grown-up stuff. But they've given us a lot of resources as well. There's so much information out there, but a lot of it is written, and that's also what we said is we're hoping to get this out on a Facebook Live and then on a podcast as well, so people can listen to it, because we appreciate that watching things can be quite tiring, or they want to watch it at a different time. So it will be Sunday afternoon from the 14th of March going forward.
And if you can't make it, like if you couldn't make it today, because I know we had quite a few followers and obviously it was really difficult for a lot of people to make it at this time. So this will be available to watch on all of our platforms, on Facebook, on YouTube and Instagram. So you can watch it at any time. If you're driving, you don't have to look at us. You can just plug your headphones in and have a listen. So it is accessible anytime. So if you can't make it, we'd love you to come though when we're live. But if you can't, you can watch it later.
Absolutely. And please share around as well. If you know someone who has some kind of chronic disease that you work with, or they're in your family, or you just want to be a more rounded person about invisible disabilities, this is not a bad place to start. Also, we welcome people, of course, who are very early in their journey with MS, who have been, doing it for decades and have some things that they would like to talk about as well, because obviously times have changed and their needs will have changed as well. So we're very early on in this journey, but we're really looking forward to it. It's really exciting. It's a good project for the year.
We're going to learn with you. It's going to be fun.
That's right. Have a good evening, everyone, and reach out to us later.
Thanks for coming.
Ciao.